Unlike prostate cancer, ovarian cancer patients have a more challenging road to remission. Well, joining us to help bring awareness to a disease that will affect 20,000 new patients this year is Caroline Cottrell, board member for Lowcountry Ovarian Cancer Alliance and an MD PhD student at MUSC. Good to have you with us.
Thank you so much.
And congratulations on your road to becoming a full-fledged doctor. This is exciting.
Yes, it's a little long, but it's exciting for sure.
It is. Well, you're explaining it's an 8-year road.
Yes.
You're halfway through.
Halfway through.
Well, we're glad you could join us. And ovarian cancer is interesting because it's not one of the most diagnosed of the cancers, right?
No, it's not the most common as far as compared to breast, which is the most common in women, or prostate, which is the most common in men.
Right, exactly. And when we do compare, because we just talked to a prostate doctor, the fact that prostate cancer, you could even go diagnosed and untreated and still expect a full life expectancy. Ovarian cancer is not the same.
Yeah, no,
Why
absolutely.
is that?
Well, I think it's because of definitely like the symptoms that women experience most of the time, as far as a lot of the tumors. They create a very high tumor burden, usually within the abdomen. You have these peritoneal tumors that can interfere with all your daily things as far as eating. That's why women experience things like feeling full very quickly as a symptom, as well as going to the restroom. So women usually have to go to the restroom more frequently, and all things related to womanhood.
Right, exactly. And when I was looking at the statistics, so someone who's been diagnosed, their 5-year outlook survival rate is at about 50%. So I realize new treatments, so everything's trying to change that, but certainly bringing awareness to it and knowing the first signs. So what would you say are some of the first signs that women should really go to their doctor and have themselves checked out?
That's always a difficult thing, is because a lot of these signs are things that women experience every month. Feeling bloated or just kind of blah, feeling full quickly, having a little bit of abdomen or pelvic pain, as well as going to the bathroom more frequently. I think any woman could say that she experiences those at least once a month.
Yeah.
So if you are having those, continuously for more than 2 weeks, it's probably time to go see a doctor.
What's an average age that one gets diagnosed with ovarian cancer?
It's women who are most likely postmenopausal, usually in their 60s to 70s, but women at any age can be diagnosed. I have a friend who I go to MUSC with, who she was diagnosed when she was 16.
Oh goodness.
So it's important.
Very young.
Yeah, it's important for all women to understand, these symptoms, because it really could happen at any age.
Yeah, is there anything that a lifestyle changes so to not as exacerbate?
There are definitely some that I think that kind of go across all different types of cancers, as far as obesity, alcohol use, and smoking tobacco, or tobacco use in general.
So kind of the usual suspects.
The usual suspects,
yeah, right.
I would say.
Tell me about the work that you do with the Alliance.
So the Lowcountry Ovarian Cancer Alliance, it's a group of survivors, current patients, healthcare professionals, and healthcare students like me. And we kind of have a 3-prong mission. One of the prongs is to support local patients. We have programs like our Lunch Bunch, so that gets patients and survivors together in one room and lets them talk about kind of the highs and lows of their cancer journey. We also have the Caregivers Luncheon, because caregivers also have their own unique struggles, so they can talk to one another about those things. We have the Teal Totes program, so all patients who are started on a chemotherapy, and this includes all gynecologic cancer patients, they get a teal tote full of just things that can add comfort, like a little hair turban, a blanket, to make the process a little easier.
That's wonderful.
And we also, as far as for our other prongs for bringing awareness, we have Survivors Teaching Students, which is a national program, so it brings patients in who have a PhD in ovarian cancer, a personal history of disease, and they get to share their experiences, and hopefully will help healthcare professionals make diagnoses easier and quicker.
And also it takes a little bit of the fear out, I would think. It's a very scary thing to be confronted with a diagnosis that you have cancer. So to be able to talk to people who've come before you and have survived and thrived, I would imagine is worth its weight in gold.
No, absolutely. And with such a high recurrence rate, it's 70% for ovarian cancer. A lot of patients experience prolonged anxiety because they're just kind of waiting, for the other shoe to drop. So having other people to talk to about that is important.
Yeah, and what we want everyone to know is that there is going to be an event happening at On-Dog Green. So tell us about this event.
Yes, we're so excited. It's the inaugural Teal Arts Festival. So it's going to be a day of food and fun and crafts, and it was really, initiated by Mike Kaufman, who I know is coming on next, as a tribute to his late wife. And it should just be a kind of a day of celebration and hopefully increasing awareness for this disease.
Absolutely. All right, so that's happening September 14th from 12 to 5 on Dog Green. It's a beautiful setting as well. It's out for the soul. It's great there. So thank you so much for sharing with us, and we're excited to invite Mike Kaufman on next. We're going to do that after this. We'll be right back.